registered dietitian and Blenderized tube feeding expert. I'm so excited to be on Kim's YouTube channel. Thank you so much for having me. I'm so excited to share with you my knowledge of Blenderized tube feeding so that as you get requests from patients for this option for their tube feeding, you can really support them in that decision and help them create nutritious blended meals for tube feeding. So here we go, let's get into the presentation. Blenderized tube feeding can be defined as food and fluids that have been blended as needed for consumption through a feeding tube. There are many other names for this practice, for example, blended diet, homemade formula, and real food tube feeding. But for this presentation, I'll be using the term Blenderized tube feeding or the abbreviation BTF. Commercial formula has a well-established place in clinical nutrition, but blended food was used for tube feeding well before commercial products came into existence. So although Blenderized tube feeding is often seen as a new or novel practice, it's actually a throwback to an earlier era of dietetics. We've been telling the public for decades that fresh, unprocessed foods are the basis of a healthy diet, and this message is of course influencing the desires of tube-fed patients and their families. Plus, it's easier than ever to discover that there are alternatives to standard tube feeding formulas. If you Google tube feeding, the option of Blenderized becomes apparent within a few clicks. It's important to appreciate that some patients and caregivers have such a strong desire for a more natural tube feeding approach that they will use Blenderized tube feeding whether or not their healthcare team supports it or even knows they're doing it. An anonymous survey conducted at the Mayo Clinic in 2015 identified that 56% of their adult home enteral nutrition clinic patients were using at least some blended food for their tube feeding, despite having been prescribed commercial formula. Additionally, a survey of Oli Foundation members in 2016 found that 90% of home tube-fed children were being provided Blenderized tube feeding for at least part of their daily intake. The same study also found that 66% of adults were using Blenderized tube feeding too. These are responses from the Mayo Clinic survey of tube-fed adults who chose to use Blenderized tube feeding instead of their prescribed commercial formula. The reasons included wanting a more natural choice, feeling more normal, and disliking the ingredients and formula. I think we can understand why Blenderized tube feeding appeals to patients and caregivers, but as clinicians, we want to know, is it safe and what are the benefits? While the literature on this topic is limited, research has shown that there are clinical benefits to Blenderized tube feeding that we should appreciate. I'll be summarizing these benefits, but if you're interested in more about the research, you can reach out to me by email and I can share some studies. In patient and parent surveys, as well as small studies of tube-fed children, Blenderized tube feeding has been found to be better tolerated than standard commercial formula. In a Blenderized tube feeding study conducted fairly recently in Toronto, 20 medically complex G-tube-fed children were changed from standard formula to Blenderized tube feeding for a 6-month period at home. In addition to finding that the children had improved tube feed tolerance on Blenderized tube feeding, they also found that the gut microbiome had changed for the better. And that makes sense. After all, a more diverse diet should support a more diverse microbiome. Another benefit of Blenderized tube feeding is that it can be significantly less expensive than commercial formula. Additionally, there's the inclusion of phytochemicals in the diet and the natural fibers found in fruits and vegetables. Also, with Blenderized tube feeding, we have the ability to customize the diet beyond the constraints of a commercial product formulary, and it offers potential to provide nearly any combination of macronutrient breakdown. Clinical benefits are perhaps not as important to patients and their families as the emotional benefits of Blenderized tube feeding. For parents of tube-fed children, there's a natural desire to nurture their child with homemade food. Although commercial formula provides convenience and a known nutrient content, it may not provide the same degree of satisfaction to caregivers. And when an adult loses their ability to eat by mouth, it's not just a loss of the taste of food and the satisfaction of chewing and swallowing. They have lost the experience of deciding what they want to eat, of responding to a craving, of grocery shopping, looking at recipes, and participating in family meals. The use of Blenderized tube feeding may lessen that loss, as the tube-fed individual or their caregiver can continue to have choices not available to them if they exclusively use commercial formula. They can get inspired by looking at recipe books, watching cooking shows, or just wandering around their grocery store and seeing what's fresh. What we eat is part of our identity, and that doesn't have to change when a person is tube-fed. On Blenderized tube feeding, an individual can have a diet that respects their personal preferences. They can be a vegan or have an organic diet and select foods that reflect their culture. Blenderized tube feeding allows for more participation in special occasions and gives caregivers the opportunity to nurture their tube-fed loved one with familiar food. Meals can also be shared. An example here is of a blended butternut squash risotto recipe for tube feeding, which can double as a delicious soup to be enjoyed by mouth with family. Now this all sounds wonderful, but Blenderized tube feeding is not without risks. In terms of food safety, research has shown that blended food prepared in hospital has higher bacterial content than commercial formula. But I think it's reasonable to assume that the bacterial content of blenderized tube feeding prepared in the home would be dependent on food safety practices and comparable to foods intended for oral intake. In regards to tube occlusions, yes, this is a risk, but that risk exists for any tube-fed patient. There's actually no evidence of blenderized tube feeding causing more blockages than commercial formula. In regards to nutritional inadequacy, there is certainly a risk of significant intake variability and potential inadequacy, and this should give pause to clinicians. We will not know exactly how much nutrition our patient or client is receiving if they're using homemade blended food, and that risk of unknown or inadequate intake should be factored into decision making. Other risks to consider include the inconvenience of preparation. Now, this is highly individual, but some people might struggle to manage the preparation of nutritious blended meals and would benefit from commercial options instead of homemade. There's also the risk of allergic reactions, especially in children, and there's a risk of medication interaction, so education needs to be provided. So now, having presented the benefits and the risks, the question is, when should blenderized tube feeding be considered? Well, I think it should be considered if it's what patients or their loved ones want, but they're not necessarily going to know that they have the option of blenderized tube feeding unless we tell them. It comes down to one of the principles of patient-centered care, which involves informing patients or their caregivers of all their treatment options, not only the ones that we're most comfortable with. For tube feeding, they have choices: standard formula, food-based commercial products, homemade blended food, or any combination of the three. For every patient, their individual situation needs to be seriously considered. What are the benefits? What are the risks? Do the benefits outweigh the risks, or can those risks be mitigated? There are many factors to consider. One of the biggest ones is medical status. Are they stable enough for blenderized tube feeding? We also need to consider GI function. Do they have any contraindications to enteral nutrition? Comorbidities should also be considered, as this will influence what food can be safely provided. Diabetes and renal disease warrant special consideration, for example. Same for any condition that is fluid sensitive, because it can be challenging to meet nutritional needs in a small volume when using blenderized tube feeding. Functional ability should also be considered. Can the patient or their caregiver manage the food shopping, preparation, and administration of blended food? It's also important to consider enteral access. Any tube can potentially be used for blenderized tube feeding, but it's important to understand what tube your patient has in place and how it may influence the safety and success of blenderized tube feeding. Gastric feeding is preferable, but blenderized tube feeding can be used in post-pyloric feeding, and in many cases, blenderized tube feeding is a viable option for J-tube feeding. Of course, if a person has a J-tube or a GJ tube, you'd want to know if there's a GI impairment that indicates the need for those tubes, and explore if perhaps an elemental commercial formula is a better option if malabsorption is a concern. Of course, like regular formula, slower infusion rates are generally necessary for jejunal feeding of blenderized tube feeding, and tolerance should be carefully monitored. You'll also want to consider the difficulty of replacing the patient's tube if it were to block. It's important to be familiar with the type of tube your patient has so that you can determine if the risk of blockage is higher or lower. Tubes that are 14 French or greater are very unlikely to block, especially if they have a straight opening at the tube tip, like the tubes in the top two photos. Tubes with side exit holes should be used with extra caution, as food must make a 90-degree turn and exit by the small openings in the side. The bottom left photo is a GJ tube with this design, and the bottom right is an NG with the same potential problem. Also, please keep in mind that a GJ tube has a double lumen, so a 20 French size tube is technically more like two 10 French tubes, and therefore should be used cautiously with blended food. So when you're working with a patient who wishes to start a blended diet, you can sometimes have them jump right into blending, or you can start them slowly. To transition slowly, you can recommend blending a small amount of an easily digested food into the established commercial formula. For example, some cooked apple and cinnamon, or a few spinach leaves, or some cooked sweet potato. In small amounts, most foods have very little impact on the formula viscosity and volume, but will add color and provide some of the benefits that appeal to tube-fed patients and their loved ones. In fact, for some people, giving their usual commercial formula a boost is enough to satisfy their desire for fresh food in their diet. Now, if you're working with tube-fed children, things may be different, but that depends very much on the age of the child. Blended food should only be introduced at an appropriate age. Depending on the age of the child, you could start by blending a single food with formula or breast milk. Keep in mind that food should be introduced as per the usual progression, and then slowly increase the variety of foods and the amount of blended food in the diet. Now, to prepare Blenderized tube feeding, you don't need much. Just a functional clean kitchen, something to strain blended food with, containers for storage, and a blender. I often hear it said that you need an expensive industrial blender for making Blenderized tube feeding. This is not at all true. Nearly any blender will be fine, but weaker blenders will have difficulty blending hard foods. So some foods may need to be avoided, and the blender may have to be run for up to several minutes to achieve a smooth blend. Also, make sure to inform your patients or their caregivers that the volume after blending can be up to 50% higher than the true volume of the blend, depending on their ingredients. So they'll need to allow time for the air to escape from freshly blended meals. When it comes to viscosity, think about the feeding method and tube size. Thicker viscosity is fine for syringe feeding in large bore tubes, but a thinner texture is usually necessary for gravity or pump administration, or if it's a small bore feeding tube. And if the patient has a low profile tube, thinner blends may also be necessary due to the smaller diameter of the extension set and the narrowing at the tube connection point. And it's not just about viscosity, it's also important to have a lump-free texture to minimize the risk of food solids causing a tube blockage. It's essential when preparing Blenderized tube feeding that good food safety practices are followed. Of course, basic food safety guidelines need to be followed at every single step in preparation, but also make sure to tell your patients that blended food should be kept for a maximum of 2 hours at room temperature, a maximum of 2 days in the fridge, and a maximum of 2 months in the freezer. Also, most blends will become thicker when stored and may need to be re-blended with a little bit more liquid to achieve the right consistency. When it comes to administration, for the comfort of the patient, you want to have the blend at room temperature or lukewarm. Otherwise, the administration of blended food is essentially the same as standard formula. You can feed blended food by pump, syringe, or gravity. So now that I've told you how to blend and how to administer blends, I'm sure what you want to know is what to blend, or what to advise patients and their caregivers to blend to make sure they're getting the nutrition that they need. There are several strategies. A popular option is the plate method, which is where you have your patient imagine a balanced meal consisting of appropriate serving sizes. Or they can actually put food servings on a plate, then blend it in the blender, adding fluid as needed until the right consistency for their feeding method is achieved. With this approach, the nutrient intake isn't really certain because there's not necessarily measured serving sizes, but it allows for a varied diet and a lot of flexibility. And the New Canada's Food Guide, or the USDA MyPlate resource, can be used to help educate patients and caregivers on how to balance their meals. Then there's the food group servings method, where you would inform your patient or their caregiver of their goal number of servings of each food group. The number of servings needed is determined by calorie level. And the USDA Choose My Plate tool is great for this because they have plans for kids and adults at many different calorie levels. Like the plate method, there will be intake variability, and it's possible for a person to choose a high number of higher volume, lower calorie foods, meaning that they may have too few calories or very large meal volumes. But generally, this is a method that is very effective and helps make families and patients feel comfortable. Also, overall intake is more known with this method compared to the plate method. There's also 24-hour blends, which are blends designed to provide complete daily nutrition. This sounds like a reassuring option, but it may be the most challenging to design, and although calorie and protein needs are likely to be met, there could be more risk for micronutrient deficiency because there's not as much variety in the diet. And when you blend a day's worth of food together, the blend that's produced may not be very palatable, and this could be a negative for some people. There are also what I call design blended meals, which are recipes with ingredients that have been selected to achieve a known volume and nutrient content. This approach is an evolution of the plate method. It involves some basic nutrition knowledge and a calorie counting app, but it can help ensure nutritional adequacy. So you'd want to tell your patients or their caregivers to aim for a certain number of calories per milliliter in their homemade blends. This can help track intake and make sure calorie goals are met. Regardless of the strategy you choose, there are elements of a recipe that should always be considered. Use your knowledge of commercial formulas. Don't just think about the calories, think about the calories per milliliter. A 1,000 calorie blend sounds great, but not if it's in a 2,000 milliliter volume. so ask your patients questions about the volume of their blends. For most patients, a minimum of 1 calorie per milliliter should be their goal. And same with protein. If the protein content of a blend is low, the patient is missing an opportunity to meet their protein needs, and this is how nutritional inadequacy can happen. Also, look at where the calories are coming from and try to make sure that carbs, fat, and protein are balanced. Also, watch for too much added salt or lack thereof. Even for tube-fed patients, it's pretty easy to reach the RDI for sodium unless there are very few processed foods in the diet. In my experience, I found that adding table salt is usually not needed if you take a close look at sodium intake from other sources. And of course, it's important to assess all these factors on an individual basis. So what about micronutrients? I'm asked this a lot. How are dietitians able to know that their patients are getting enough if they're not using commercial formula? Well, we need to assess micronutrient adequacy in the same way we would assess this for patients who eat by mouth. If a tube-fed individual has a wide variety of foods in their blended diet and is getting plenty of calories, there's a low risk of inadequate vitamins and minerals. But you want to ask the usual questions, such as, are you using fortified grain and dairy products? Do you add salt to your food? Do you eat meat? Are you a vegan? Do you have a variety of fruits and vegetables in your diet? Depending on your assessment, you may want to recommend a supplement. But this would be done no differently than for an adult or child who eats by mouth. I recommend the same approach when it comes to overall nutritional adequacy. It's the same as oral intake. So talk to your patients or their caregivers and assess how they're doing. Ask them about their weight and energy level. Ask about what they're blending and assess if their blends are calorie dense and if they're including proteins. Are their blends unnecessarily thin? Remind them of their calorie per milliliter goal. And judge if their meals should be bigger or smaller. Make sure they have dietary variety, ask if they're using any supplements, and find out what they do when they're too tired or too busy to make blended meals. Maybe a formula or a food-based tube feeding product would be a convenient alternative to homemade blends when needed. So my overall recommendations for patients and families using Blenderized tube feeding are as follows. You want to monitor their weight, and if they're able, have patients or caregivers use an app to track intake. I like the free app called Chronometer. Or you can have them count food group servings. And if they're making their own recipes, have them record the volumes and aim for at least 1 calorie per milliliter. You actually want to discourage excessive amounts of fruits and vegetables because they can increase the volume of the blended meals and lower the calorie concentration. Suggest high calorie, high protein foods such as nut butters, avocado, foods that give a lot of energy or protein in a small volume. And prescribe supplements only based on individual need. But most importantly, provide support. Remember, these are people who are probably going to do Blenderized tube feeding with or without your help. So even if you feel like you don't have a lot of expertise in this area, remember that you are highly knowledgeable compared to the patient or their family, and you as a dietitian have all the skills and abilities to help them prepare a safe and nutritionally adequate blended diet. So be there for them and support them as they adjust to their feeding tube and to the process of making blended meals. I promise you'll learn a lot from each other. If you'd like more information about Blenderized tube feeding or you're looking for resources for your patients, such as recipes and handouts, head over to my website, naturaltubefeeding.com. I also would love it if you would check out my Instagram, it's at naturaltubefeeding, or my Facebook page. And I'm about to be starting my own YouTube channel where I'll be showing Blenderized tube feeding recipes, tips and tricks, and lots of tutorials. So please subscribe if that interests you. Thank you so much for listening, and thank you, Kim, for having me as a guest on your channel. I really appreciate it.